Uganda, commonly known as the Pearl of Africa, lies in the African Great Lakes region and also lies within the Nile Basin. Despite all this beauty, the desire to make its people live better and healthy lives is still eminent.
Having been orphaned at an early age of 13, I was helped growing up by several people, helping me through school. And when I finished my program of dentistry, I wanted to make an impact in the community. And around the time I finished, there was an insurgency in northern Uganda, civil war caused by coin. And people were living in internally displaced people's camps. And so I often made visits there and saw a great need of people suffering from toothache. There was a lot of tooth decay, children and adults. Most of our camps that we made that time, we could not finish the numbers of the people who came. And so I saw a great need, and I thought to myself, how can we reach out?
Rand Dental is a registered charity Christian organization with a vision of relieving communities from oral pain. This is being achieved through community public oral health care programs that involve reaching out to oral health needs of the underprivileged, equipping communities with the love of God, and transforming disadvantaged communities through relief dental care in partnership with local and international organizations.
So Rand Dental was coined out of a great need in the community with the people who had a lot of dental challenges. And after that, we thought of coming up with Rand Dental, which stands for Reaching Unreached Dental Needs.
Touched by the love of Jesus Christ in a community of need, Rand Dental derived its vision from skilled hands reaching out to communities through oral health care as a ministry to bring communities to the love and knowledge of Jesus Christ. Since 2004, Rand Dental has provided voluntary work and supported ministry to these communities, reaching out to populations, preaching, healing, training, transforming and saving lives. Notable progress has been made in the achievement of key health indicators in the country. However, most oral health care facilities are found in urban centers and charge a fee, except for government health facilities which do not afford to carry out most dental procedures other than dental extractions. Multiple factors make oral health care both unaffordable and inaccessible to the majority of rural people in Uganda, especially the children, which are the primary target for Rand Dental. Currently, we have about 200 dental surgeons serving a population of 45 million people. Dental surgeons at a degree level to population ratio of 1 to 225,000. According to the oral health policy, Uganda has a dentist, both degree and diploma holders, to population ratio of 1 to 158,000, compared to the USA, where a dentist population ratio is 1 to 1,810. The effort of government has largely been to expand urgent dental care, dental extractions from National Referral Hospital to Regional Referral and District Hospital, with a few healthcare center folds, leaving a large rural population without oral health care at the lower healthcare delivery points like Health Center 3, Health Center 2, and VHT.
The recent survey show that there is about 80% of Ugandans who are suffering from toothache, and about 55% have untreated dental caries. One of the ways our healthcare is organized in Uganda is that we have national referral hospitals, we have regional referral hospitals, district hospitals, and then healthcare centers in the lower areas, Health Center 4, 3, 2, and then 1. Now, most dental services in Uganda that offer mainly tooth extractions are centered at the National Referral Hospital, regional and district referral hospitals.
I'm so grateful to the Lord for the ministry of Dr. Brian. And what is more interesting is that he has used his professionalism to be able to preach the gospel. As a dentist, he has gone for mission trips and taken the team from the team of dentists to go, and as they work on people's teeth, they are also ministering to the patients as they work on them. And this ministry has taken root because there are so many people who have dental issues, but even with their dental issues, they do not know the Lord. But by working on them with the hand of a doctor who knows the Lord, it has been wonderful that by the time they finish working on your teeth, yes, you have that pain, but you also have Christ. And I want to praise the Lord for this ministry, and I want to pray that we can support this ministry because it's a ministry that is going way beyond even to reach to the grassroots. And we have experienced this. We've been to the field with Dr. Brian, and we have seen God's love and mercy being extended through the ministry as a dentist, using his profession to serve the Lord.
Amanya gange nze nalibowa gift ngyasomera ku ssomero lino njize nti okusenya amannyo osookera kuga waggulu ng'osenyoza wansi era nebaza nnyo abasawo abatuyigiriza.
Twajyaga tubikora ariko ubundi twabikoraga mu mafuti, noneho ukagira ukuntu ubrashinga ibyo kurya bigasigara mu menyo, ariko ubu ngubu abana bacu barabyize n'abarimu bamwe barabyize n'igice cyacu turabyize.
Brushing is not taken as a priority in most of these poor communities, and yet most communities right now, they are able to access sugary foodstuffs which are now being packaged by small companies as sweets. And so you're having now a problem where there is increased uptake of sugar but without adequate brushing. So we find a lot of rheumatoid caries, a lot of trauma for the children's teeth, and all this is not attended to, and most of the time it gets complicated. The most kind of disturbing trauma that I've seen is something we call infant oral mutilation, or what we call locally here ailing, false teeth removal. There is a tendency when children are developing teeth, the parents think that these teeth are false, and so they take these children to a detoother or a village witch doctor who uses a bicycle spoke to pierce the emerging tooth, and quite often they destroy the tooth germ, which eventually, when they grow teeth, they either have missing teeth, permanent teeth, or actually the canines, especially it happens in the canine area, the canines are traumatized. They will come when they are half or actually deformed. All these are concerns, all these are things that cause us pain, and we feel we need to be able to reach out to address most of these situations.
Moving forward, Run Dental has transformed into Run Foundation, adopting a more comprehensive and sustainable approach to relieve communities from oral pain and associated health complications like oral manifestations of HIV/AIDS, dental abscesses, and their impact on the quality of life. The foundation oversees several key initiatives. The Children's Dental Community Clinic serves as a referral center for community outreach clinics in Uganda, with the capacity to treat up to 100 children daily, and host Dr. Ryan Roberts Children Foundation that offer critical dental care to vulnerable children. Additionally, the Galilee Health Institute School equips and trains students from local communities, enabling them to return and serve their communities effectively and hence bridge the gap of accessibility and affordability of oral health services. Evangelistic community outreach programs extend dental treatment to unreached communities with limited access to oral health care services while preaching, teaching, and healing lives. Furthermore, the foundation offers international dental students elective placements to conduct oral health education, dental screenings, and treatment for both children and adults. Run Foundation is actively fundraising for essential causes, including the construction of an educational facilities like a 3-classroom block and a library block. It also is looking for sponsorship towards students to acquire critical skills and encourages them to serve their communities. Lastly, supporting community outreach programs, ensuring that dental care reaches those in need.